This is the Kidney Health Series, brought to you by Narmada Kidney Foundation and supported by Dr. Reddy's Lab. Hi friends, and welcome back to another edition of our Kidney Health Series. This is Bhaskar Rodriguez with you on the show. And in the studios with us, we've got Dr. Prashant Rajput. Hello, Doctor.
Hello, Bhaskar.
And we've got Head of Department of Urology, Global Hospitals, Mumbai, Dr. Pradeep Rao, who's also a laparoscopic surgeon. Welcome, Doctor, to our show.
Hi, Bhaskar.
Dr. Prashant, the first question to you goes like this. Why does one require a transplant?
Bhaskar, transplant is required in patients who develop end-stage organ disease. That means your organ has been completely dead and it can no longer do its physiological functions. That's why you require a transplant. Like in case of a kidney, when you develop end-stage kidney disease, the treatment of choice for end-stage kidney disease is to get a kidney transplant, which comes from a donor which is either living or a cadaveric donor. For end-stage liver disease, you require a liver from a cadaveric or a living donor. But in case of heart or lung transplant or kidney pancreas transplant, it has to be from a cadaveric donor. So transplant remains the treatment of choice for any patient who develop an end stage because it is more physiological. For kidney, there is an option for dialysis, which is a partial treatment as compared to the transplant. Therefore, any patient with end stage kidney disease, he is deemed fit for a transplant. He should receive a transplant because it completely gives you or completely transforms you from a patient to a near normal human being. That's why a transplant.
Mm-hmm. And in that case, does one require just one kidney or both the kidneys?
It's only one kidney. You can have a completely normal life with a single kidney. The longest surviving recipient of a kidney transplant today is more than 60 years.
Oh, really?
Yeah.
Oh, wow.
And
that's amazing.
It is with a single kidney. There are people who are born with single kidney and they die at more than 100 years of age. The one kidney is enough to for a normal activities for any patient, and it can be done.
And what are the procedures that one follows, doctor?
See, for a living donor transplant, you need to have a healthy living donor within the family or slightly distant family members where you require a permission from the government. And once you have a living donor, if the donor is fit to donate, the age of the donor in the living donor transplant should be between 18 years to the upper age limit is not defined, but ideally we require less than 65 years of age.
Doctor, can you elaborate on this? When you talk about a healthy person, what do you mean by that?
A healthy person means that a person who's donating the kidney should be free from any long-standing diseases like diabetes and hypertension, which increases the risk of chronic kidney disease in the future. He should not be having recurrent infections like TB or any hepatitis or HIV, which could be transmitted. And he should be free from any malignancies because it is known that malignancy in a donor could be transmitted through an organ transplant. So it is mandatory that a person who is donating the kidney should be should be a reasonably healthy person. The age is not defined, which I told you earlier.
Mm-hmm. Doctor had asked you this question: who is a donor?
See, as per law, of any family member who is willing to donate to his near and dear ones becomes a donor who is absolutely healthy. And if somebody who is distantly related could also donate, provided no other family members are fit to donate.
Mm-hmm. And when we talk about transplants per se, are there any advanced methods today for this procedure?
Yeah, there are many methods. Especially, there have been a revolution in donor surgery, and I think Sir will put a lot of light on the advancements in the donor surgery.
So you are going to explain it to our listeners what exactly it is all about.
So all these years, donor nephrectomy had not changed for more than 40 years, and the conventional open donor surgery is done by taking a very large incision, which ranges in size between 1 to 1.5 feet. on the side of the patient. That's almost like cutting the patient in half, and removing one of the patient's ribs to get access to the kidney.
Oh, really? Oh, is it?
Since it was first introduced in the United States, laparoscopic donor nephrectomy has been the procedure of choice over the last 15 years to remove a kidney for transplantation. This is because we need to remember one very important fact, that the person who's donating a kidney is not really a patient. It's a normal person like you or me. They're donating a kidney out of purely altruistic reasons, for love of their family or love of a friend. And this person should not be treated like a patient. And this is one surgery in the body where any sort of complication is unacceptable. Also, these are the people you want them to get back to normal activity and work as soon as possible with an absolute minimum of pain, because they're not really suffering from any disease. For these patients or these people, laparoscopic donor nephrectomy is an ideal choice, because this is keyhole surgery for doing a donor nephrectomy.
Right, doctor, how is this procedure done?
So what we do is we take 3 small holes in the abdomen, in the upper abdomen, which are ranging from 1 centimeter to 5 millimeters. And through these holes, we pass in a telescope and our instruments, which help us to dissect out the kidney. Once the kidney is fully dissected out and we're ready to take it out, we take it out through a very small incision, very low down in the abdomen, below what we call the bikini line. This ensures that the incision is hidden and remains very cosmetic, so the patient doesn't even look like he's been operated afterwards.
Oh, really? I mean, it's absolutely scarless, in other words?
No, this procedure has a very small scar which is hidden in the bikini line, like I said.
Right.
There is, although, a newer technique which we developed about 5 years back, which was developed right here in Mumbai. And this technique gives almost scarless donor nephrectomy, where we take out the kidney through the belly button. But the conventional laparoscopic donor nephrectomy, which we do, has almost no scar, and the scar is hidden within the underwear.
Oh, I see. Doctor, what are the advantages for a surgery like this, the keyhole surgery, like you said?
So we have now data dating back 15 years, which shows that after an open nephrectomy, which patients used to undergo earlier,
right,
the return to work is at about 1 month, and the pain lasts for about 9 months. And some patients complain of pain even after that. While after donor nephrectomy, we have patients getting discharged within 3 days. They're returning to work within a week, and the pain overall lasts for less than a month. So this is a huge improvement in our earlier methods and enables these patients to get back to a normal life as soon as possible.
Right. In the earlier surgery that you talked about, the open surgery, you said that one of the ribs is also removed. Does it affect the rib cage over a period of time?
No, but it gives rise to significant pain.
Oh,
because removing the rib, you're cutting a bone, you're actually creating a controlled fracture.
Yeah,
there.
I would imagine so, because that's where, I mean,
it's a fairly painful procedure.
There's enough of discomfort already there. Doctor, tell us, after this keyhole surgery, how early can a donor resume normal activity?
The patients are usually discharged within 2 or 3 days from the hospital. And once they go home, they don't have any stitches. So they are free to resume normal activity. What we have found is that within 1 week, they are mostly comfortable and ready to go.
Now, this happens in the case of the donor as well as the recipient?
No, the recipient remains in the hospital for a little longer time.
Why is that so?
Because basically, I think Prashant will be the right guy to answer this question.
Yes, Dr. Prashant.
See, recipients will remain longer because lot of changes happen in the recipient. Once they receive a transplant, in the initial few days, they have a catheter in place. They have a drain in place, which remains for around 5 to 7 days. And once that is out, usually in our center, we discharge patients around 7 days. 7 days is our main time for discharge. And after 7 days, they come for a bi-weekly follow-up. And subsequently, after a month, it is once a week follow-up. Usually, by end of the month or end of 3 months, we ask them to resume duties because it depends from patient to patient. For a small child, we ask them to resume the school after 3 months. For a person who's working and who's the sole breadwinner or who has a desk job, we ask them to resume within a month.
Mm-hmm. What's the observation period post-surgery?
It is the initial few weeks where the rejection risk is higher. We ask them for a bi-weekly or tri-weekly follow-up, and subsequently after a month it is once a week. After 3 months it is once in 10 days. After 6 months it is once in 15 days. After 9 months it is once in 3 weeks. After a year it is once in a month. After 2 years it is once in 2 months. After 3 years it is once in 3 months. So that is what the protocol we follow.
Doctor, we've got just about a minute to go. In short, can you tell us if there is any further advancement in laparoscopic surgery?
I think I mentioned it in passing in the in my earlier answer that we developed a new procedure which was developed here in Mumbai and now is popular worldwide, which is doing an entire surgery only through the belly button. This was known as single port surgery, and it was a significant new advance in laparoscopy, which we presented for the first time in 2007. And a few centers have already started doing donor nephrectomy entirely through the belly button. So this leads to an almost scarless surgery. So what happens is that at maybe a month after surgery, you can't even make out that you have been operated. Right. And what we have found in donor nephrectomies with studies between laparoscopy and single port surgery is that the pain level is much, much lower.
Doctor, I'm going to shoot these emails straight away to you because that's all related to whatever that you're going to say right now. This first email says, I'm a kidney donor, 36 years of age, donated a kidney to my sister 3 years back. It was an open surgery. I think last time we talked about this open surgery, right? And even today, she says, I still be the reason.
So during this open donor nephrectomy, there is a resection of a rib and the chance of injury to some small nerves which run alongside the lower part of the rib. And it's fairly common to get numbness and some sort of pain for longer periods of time after donor nephrectomy. Basically just requires treatment, pain relief with some medication and follow up with some good pain management consultant who can help her to get rid of this pain.
But in situations like these, doctor, they say that it's not good to take too many painkillers.
No, not painkillers as such.
So when you talk about pain relief...
So what these pain management consultants do is if there is any particular nerve which has been sutured or is hurting the patient, they can give an injection of a local anesthetic in that spot and reduce the pain.
But then that's temporary, is it?
It can be temporary, and if it works, you can do a slightly more permanent solution also.
And how is that done?
With the same injection, but instead of a short-acting local anesthetic, they can use something which is longer acting.
But then does that become permanent, or does that again remain for a couple of weeks to
and sometimes
a month?
The numbness can remain for a long time.
Okay, so that means there's no sensation at all
in some small part of the skin. Yeah.
Okay, where the injection has been given. Huh?
No, where the nerve has been affected.
Or the nerve has been affected. All right, okay. Then there's another email that says, I'm a 23-year-old and my sister is a patient of CKD, chronic kidney disease, and planning to donate my kidney. And then she says, I'm also a professional model. Which procedure would be ideal for me?
So for professional models, we have two options. We have either the regular laparoscopic donor nephrectomy, or there is a more advanced procedure known as single port donor nephrectomy, which is virtually scarless, where we take out the kidney through the belly button. It depends on the patient's habitus, and we have to see the patient and discuss which option is better for them. But even with the regular laparoscopic donor nephrectomy, which we are doing all the time, the scar is in the bikini hairline and right. It's almost invisible. So either option would be good. For certain patients, the single port procedure also might be suitable.
Right. Doctor, for those people who probably missed out on our last program, could you tell us in short about this keyhole surgery?
So with keyhole surgery, what we do is we take 3 small incisions, usually between 5 millimeters to 1 centimeter. And these are in the upper abdomen. Right. And through this, we put in a telescope and 2 instruments with which we can dissect out the entire kidney. And once the kidney is separated, normally what we do is we take a very small incision low down in the abdomen where it's hidden in the underwear normally. And through this, we can take out the kidney. This incision is between 6 to 7 centimeters. And the kidney comes out through this.
And the entire procedure is about how long?
It takes about an hour to an hour and a half, which is also much shorter time and a less anesthesia time than an open donor nephrectomy. And obviously, because there's no muscle cutting and no removal of any bones during this procedure, it's a much less painful procedure.
Doctor, there's another email over here that says, I'm a 56-year-old diabetic and end-stage kidney diseases, and my wife is 50 years old. She's donating her kidney to me. Which procedure is less painful, as we both work and hold our regular jobs?
So obviously here the laparoscopic donor nephrectomy is a lot less painful. The person who's donating the kidney, I can't really call them a patient. They're back to work within a week, and they're pain-free within 1 month after the procedure. They can return to any normal activity within a week or 10 days. They're only in the hospital for 3 days, so there is minimal disruption to their life, which is the way it should be, because these are not really patients. They are noble souls who are donating their a part of their body so that somebody else can live a normal life.
Right. Doctor, what are the results any different between open and laparoscopic? Keyhole surgery. I like the term keyhole surgery.
So the open donor nephrectomy is a procedure which has been here around forever, and that's the way transplant was always done.
Right.
But since the introduction of laparoscopy for donor nephrectomy in 1998, it's now 15 years, and the results are exactly comparable to those with the open surgery. There's absolutely no difference except in the reduced amount of pain and the reduced amount of morbidity of the surgery. The complications are the same, which is almost none, and the results are equivalent. So that's why we can safely say that this is the only way to go for patients who require a donor nephrectomy today.
In your several years of experience, has there been any downside to this procedure?
No, I have not seen any downsides to this procedure. There were some concerns when we started about how long it takes to take the kidney out through a smaller incision as we do now. But we have realized now that the results of the transplants, which we have done using a laparoscopic donor nephrectomy or open donor nephrectomy, are exactly the same.
So and how long did it take you all to get down to this just 1.5 hour surgery kind of a thing from the initial stages?
It takes about 10 or 15 surgeries to get used to it, because initially, like I mentioned in the earlier program, this is a surgery where you cannot afford to have any complications, because you're not operating on a sick person, you're operating on a normal person.
Right.
You cannot afford to have any complications. And so obviously people starting off doing this procedure are going to be more careful. If you're doing the same procedure for a kidney cancer, the stress is a little less, because that is, after all, a disease you're trying to treat. Here, you cannot afford any complication of any sort. So you're going very slow. And once you get used to the procedure, 10 or 15 surgeries, you're good to go. And time comes down to 1.5 hours.
All right. Well, listeners, we also have a donor in the studio, Mrs. Sushmita Shah. She's donated her kidney to her son, who's 44 years of age. And tell us how it all started, and when did you decide to donate your kidney?
Actually, my son suffering from the kidney before 8 years.
Oh, 8 years, huh?
Yeah.
All right.
Or at that time, I decided I will donate my kidney. So, last September month, he is very sick and admitted in the hospital for infection. So, Dr. Bharat Shah is my डॉक्टर, इन्होंने डिसाइड करके बोला कि अभी इनका ट्रांसप्लांट करना पड़ेगा. अभी तक इसका डायलिसिस भी नहीं हुआ था. तो मैंने तो डिसाइड किया हुआ था, और 2 साल पहले भी हमने टिश्यू मैचिंग और ये सब करके रखा था. तो immediately we had decided, because I'm a fit.
For 8 years that he had this kidney problem, he was not on dialysis at all?
No, not at all.
Okay.
और luckily I have no diabetes or no hypertension.
Oh, excellent.
So it's easy to match all the...
Right. Like Dr. Prashant said in the last program, a healthy patient, even though you are 60 plus,
64,
you still come under the...
years.
64 years, wow.
Yeah.
And you still come under the category of being a healthy patient, because you don't suffer from diabetes nor hypertension. So you took this decision in the month of September that you will donate your kidney.
Yeah.
And how did you decide on this laparoscopic surgery?
Dr. Bharat Shah decided what they are doing, because the doctors are God for us.
Right.
इन्होंने जो किया वो हमने फॉलो करते गए, क्योंकि we have इतना भी डाउट नहीं था हमारे मन में कि हमें कहाँ फंसेंगे. ऐसा कुछ भी नहीं था. डॉक्टर शाह ने जो बोला और इन्होंने जो भी टीम हमें नक्की करके दिया, वी आर डिसाइडेड विथ हिम.
Right.
और
did you have to go on any special diet before
No,
The surgery?
not
Nothing
before.
at all?
Nothing
at all?
Nothing.
Okay. And post-surgery, what was it like? How long did it take you to recover after that?
In the hospital, 3rd day, I am going to the washroom.
Okay.
5th day, I go home.
Right.
घर जाके मुझे कुछ भी काम के लिए मुझे किसी से बोलना नहीं पड़ता कि प्लीज टेक मी द टॉयलेट, गिव मी द फूड, आई गो टू डाइनिंग टेबल एंड टेक द फूड.
Okay.
But family members also pamper me.
Yeah, I know. But that happens in every case. Our
yeah.
family members love to pamper you.
Yeah, correct.
Yeah, right. And of course, you are the star of the family because you've donated a kidney to your son. So you become the star of the entire family. So, which is excellent. And now you have resumed your normal activity, right?
या आई एम अभी मैं मेरा सोशल वर्क जो करती हूँ लायंस में, मैं मेंबर हूँ लायंस क्लब में, और आई एम ए रीजन चेयरपर्सन. तो आई हैव 15 क्लब्स अंडर मी. So I am going everywhere. I am visiting their clubs. And
so you don't feel like you have just one kidney?
No. Nothing is happened to me.
Well,
No.
I think this is excellent because our listeners who are listening in right now and those who are hesitant about donating kidneys, I think could take a cue from Mrs. Shah over here, who has actually said. What do you say, doctor?
Absolutely. I think Mrs. Shah is an exemplary patient and she shows the value of doing a laparoscopic procedure.
Yeah, because I'm looking at the age factor over here. Somebody who is 60 plus, 64 years like she says,
Exactly.
and who's not in their 30s or 40s.
And here, less than 2 months after the procedure, she is already going to the gym.
You were listening to the Kidney Health series brought to you by Narmada Kidney Foundation and supported by Dr. Reddy's Lab.